For the last 15 years, FDSA has put focus on fistula program by raising funds for women with obstetric fistula.
Fistula is a very, very devastating and traumatic condition, obviously for women, but by extension for men and the children and everybody else.
So obstetric fistula is a severe birth injury. It occurs when a woman in labors for long, sometimes more than 24 hours. So fistula occurs as a result of prolonged labor. Basically, the tissues between the baby and the pelvis is usually the bladder and also the urethra, and then on the back side we have the rectum, and the anal region. So if they all develops between the reproductive tract system and the urine system, then you end up with leakage of urine, which is continuous and all the time. If the damage occurs on the back side, where you find the rectum and the anus are affected, then you end up with the leakage of stool all the time.
So most of these women come from very, very poor backgrounds because they are not able to afford the surgery. Not only that, most of these women have been trying to give birth at home, especially when maternal health care in Kenya was not free. What used to happen? They give birth at home. So not only does she have to live through leaking stool or urine, she also has to live through the pain of losing a child.
A lot of emphasis had been given to these other health problems. And fistula was one of the most neglected area particularly of concern to us, even as health workers. And we thought if we now took this as one of our priority area, not only to help women to be repaired, but also to educate. So it was both to educate for prevention as well as for corrective surgery.
In Kenya, it is estimated that roughly 3,000 women and girls develop fistula every year. This number could, however, be understated, as many women hide in shame with the condition for years.
I've been in the society as a nurse. We have been involved in fistula repair for women who are affected in all parts of the country.
These all can be corrected surgically through a repair surgery. This is a complex surgery, quite specialized, and basically the cure rates, they are quite high. It's possible to repair as much as almost 90% of the patients, and they get well. So surgery is very important.
You know, this fistula is like an outcast in Kisii. Watu wamejitenga, hawaishi na watu wengine kwa vile because of the nature of the disease.
Tangu mwaka 2015 ndio nilianza nikisikia makonjoro kwa sudden inamwagika, lakini without any direction. So nikashindwa kwa nini kimetendeka. So mimi nikaona ni jambo ya kuniaibisha sana. Sikuhisi kuambia mtu yeyote. Nikaona watu watakuwa wakiniona wananipointi, wanasema huyu anajikonjoreanga, anajikunianga. So nikanyamaza.
I got married when I was only 19. At 20, I got my first child. At 22, I got my second child. And the day I labored, I could not reach the health facilities very, very fast because we were staying about 25 kilometers away from Bungoma District Hospital. And the nearest health facility was a dispensary that was not working during the night. We only used to have services from Monday to Friday. The weekends there were no services.
I used to have some leakage which I didn't understand after giving birth because I was young. and I think it was caused by prolonged labor. I went to the doctor to ask for help, but the doctor told me it was an infection. He gave me some medicine, but after the medicine, the problem still continued. And I didn't know what to do. And I didn't tell anyone, I didn't tell my mom. I used to live with my mom initially before I got married. And even after my marriage, I didn't tell my husband. There was no one to tell. It was something shameful. I didn't tell even my friends. No one knew. And I've been living like that. Traveling was a problem because I never used to have a running stomach. When I get running stomach, I had to rush to the toilet. If there is no toilet nearby, everything will just come out.
You are on duty, so you have to ask for permission to go home and change, wash, and then go back. So every time I could fake. I could tell my head teacher, "Sir, I'm just going somewhere, I'm coming back." So I could rush to the house, change, and then go back to school. It went on like that. Then in the year 2000, I decided to vie for a seat in the teachers' union. And then we went around campaigning, and you know, when you are addressing people, they listen to you, they want to know what you're saying. But at a given time, you realize that you want to release air. And you know, it could come out with a sound because, you know, all the two ends are open, you know. So it could make a sound. So I could address people, but so scared. There was a time I went to Nairobi, then I went to my sister's child became sick, then we went to Kenyatta. So when we went to Kenyatta, I saw a big banner talking about the fistula, wherever. Then I shared with my sister. She told me, "Oh, you've had this all along." I said, "Yes." She told me, "This is where they do it." So I told her, "The day you will hear, tell me." So in the year 2016, she heard about it. Then just as I arrived in school in the morning, she called me. When she called me, I went straight to my head teacher's office and told him, "Sir, I want to go to hospital." It took me time to explain. I walked out of his office first, niende nijipange on how I'm going to explain my situation. So I went back to him and told him, "Sir, I've been living with a given condition for a very long time." And we had worked with him for 6 years. And I told him, I gave him example of some incidents whereby I could tell him, "Sir, I'm just going out and I'm coming back." And I had to tell him the truth now. I told him, "This is what I've been going to do." And the Flying Doctors of Africa are doing operations on people with this condition, and I think this is my time. He told me, "Go." So the next day I was in a shuttle going to Nairobi. I went to Kenyatta, they prepared us for theatre and they did it.
Namulende, Nam, Namulende, Yes, Namulende, Yes, Namulende, Yes, Namulende. Wonekera na ajitu kuigurenderetie gukwana matangazo na riba ajite kondosia majita likoru esinkurara mbia nkurara timbu atibo kongobono bwa machenje mbiyande.
I want to assure you that from that time I gained back my confidence.
I can travel without being scared of wetting myself.
Speaking before people and my freedom to eat what I want. I had peace of mind.
I'm happy.
Ninaona nitakuwa nikielimisha wamama wenzangu.
If there's anything good that has ever happened to me, is that operation.
Part of our efforts to help women includes raising awareness and educating men about fistula and the challenges that the women go through before treatment, thereby reducing the number of women who are abandoned by their husbands when they get fistula.
So the message through media has even shown us that there are so many people suffering out there but they have not been coming to the light to know what they should do. We are proud to know that those patients, we can restore their dignity through these fistula operations so that the ladies can feel that they fit in the society.
So these days, the numbers have reduced. We are seeing people coming by themselves, and it is as if the old ones, the old cases are now coming down. The few now we are getting, they are the new cases. Otherwise, frank doctors, they have helped us also so much because they assist us during the camps, and at least we share the cost with the hospital. So we are grateful and very happy for the HOVA.
I think fistula, we should look at it from the old adage that prevention is better than cure. And if women do not know the signs and symptoms of these problems, they will not be able to. So education during the antenatal care, and also education in going to seek medical or health care as soon as one finds that is not able to deliver. It should be a national health program which should be incorporated in maternal and child health. If it is done that way, it will go a long, long way to eradicate, and it can be eradicated.
It is our endeavor to treat as many women as we can. You too can be part of the difference through becoming a member or contributing directly to the Fistula program. With us, it's people that matter.